You look down into the bowl, you see a streak of red, and your heart immediately skips a beat. But then, almost just as quickly, you let out a sigh of relief. You tell yourself that it is okay, and that it is probably just a hemorrhoid. It makes perfect sense why you would think that. Hemorrhoids are incredibly common as we get a little older, and frankly, a hemorrhoid is exactly what we want it to be, because the alternative is just too scary to even think about. But here's the dangerous truth that most seniors miss until it is far too late. Colon cancer and hemorrhoids wear the exact same disguise in the early stages. They often feel identical. They look the same at first glance, and they trick thousands of smart, health-conscious people every single year into treating a potentially deadly disease with a simple drugstore cream. I have seen men and women sit in my clinic absolutely stunned because they spent 6 months waiting for a stubborn hemorrhoid to finally clear up, not realizing what was actually growing quietly inside them. But you are not going to make that mistake, because today I am going to show you exactly how to tell the difference. There is one subtle hidden sign, a very specific pattern in how your body behaves, that a swollen vein will never cause, but a tumor almost always will. By the end of our time together today, you will know exactly what to look for, the specific color shades you can never ignore, and the exact moment you need to bypass the pharmacy aisle and pick up the phone to call your doctor. To understand why these two conditions mimic each other so perfectly, we have to look at how our bodies change as the years go by. You see, the lower part of your digestive tract is lined with a very delicate, complex network of blood vessels. After decades of lifting groceries, working, sitting, and just going about everyday life, the tissue supporting those vessels naturally loses a bit of its bounce. The veins can swell, they stretch, and occasionally they bleed. That is all a hemorrhoid really is. It is a structural wear and tear issue, much like a varicose vein you might see on your leg. But this is where the real danger begins for so many folks. Because we are so familiar with this everyday nuisance, we become completely blind to the fact that a cancerous growth in that exact same area produces the exact same early warning sign: a few drops of blood. Both conditions are happening in the exact same neighborhood of your body, which makes it incredibly easy to blame the harmless neighbor for the damage the dangerous one is causing. Quick favor before we go any further: drop your city, state, or country down in the comments for me. When I see where folks are watching from, it really helps me understand who I am talking to and tailor my advice for the health challenges you might be dealing with where you live. I read every single one. Now stay with me, because what I am about to explain about how these two issues behave differently goes against what a lot of people have always assumed. When a swollen vein acts up, the bleeding is almost always caused by simple friction. You use the restroom, there is a bit of physical pressure, and the fragile skin simply gives way. It is a surface-level event, but when a tumor is silently growing in the colon or rectum, it is actively building its own chaotic, messy web of blood vessels just to feed itself. These new vessels are incredibly fragile. They do not just bleed from pressure, they leak on their own. And understanding how that blood travels, and what it looks like when it finally arrives, is the key to protecting yourself. Let me tell you a story about a gentleman I know. We will call him Arthur. Arthur is 68 years old, a retired grandfather who loves spending his early mornings out in the yard, tending to his garden before the neighborhood even wakes up. He is the kind of man who takes a lot of pride in being self-reliant. He never complains, and he certainly never makes a fuss about his health. One Tuesday morning, Arthur noticed a tiny bit of bright red on the tissue. It was not a lot. It was just enough to make him pause. Like most sensible folks his age, he figured it was just a minor flare-up. He had dealt with hemorrhoids in his late 40s while working long hours, so he felt like he knew the drill. He made a quiet, quick trip to the local pharmacy, picked up a familiar, soothing cream, and went right back to his routine. He kept the issue entirely to himself. He did not want to worry his wife, and he absolutely did not want to schedule an awkward, uncomfortable conversation with his doctor over something so trivial. Weeks slowly turned into months. The tricky part was that sometimes the bleeding stopped completely for a week or two. That gave Arthur a tremendous false sense of security. He would tell himself that the cream was finally working and the problem was resolving. But here is what most people do not realize until they are sitting in a clinic. Cancer does not always bleed every single day. A tumor can bleed intermittently, making you think you are healing when you are actually just experiencing a temporary pause in the symptoms. 6 months down the line, Arthur was not just dealing with the occasional spot of red. He was feeling deeply, inexplicably exhausted. He could barely keep up with his grandkids on Sunday afternoons, often needing to sit in his recliner after just a few minutes of visiting. His stomach constantly felt tight, as if he had just eaten a massive dinner, even when he had completely skipped lunch. When his wife finally noticed how pale and worn down he looked, she practically dragged him into the clinic. And that is when he learned the hard truth. His stubborn, everyday hemorrhoid was actually a growing mass in his lower colon. Now Arthur is a tough man. He went through the surgery and the treatments, and I am so incredibly happy to say that today he is cancer-free and back in his garden. But he lost an entire year of his life to harsh medical treatments that could have been completely avoided, or at least greatly minimized, if he had caught it on that very first Tuesday. He assumed the drugstore cream was just taking a long time to work. He did not realize the cream was completely useless against what was actually happening inside his body. And that brings us to the absolute most critical thing you need to check the very next time you use the restroom. When you look in the bowl and see something concerning, I know the immediate natural reaction is just to flush and look away. It is human nature to want to ignore bad news. But I need you to pause. The very first thing you must do is look closely at the exact color of what you are seeing. Remember what I said about those fragile blood vessels acting up? Here is why it matters when you are trying to figure out what is happening. Blood from a standard hemorrhoid is almost always bright, vibrant red. It looks incredibly fresh, almost like a paper cut on your finger. The reason for this is simple geography. A swollen vein is located right at the very end of your digestive system. When it bleeds, the blood immediately leaves the body. It has not had time to dry out, and it has not mixed with any of your digestion. You will usually see it strictly on the toilet paper, or maybe leaving a few bright drops in the water. But this goes against what you have probably been told about how serious internal issues actually appear. If a tumor is bleeding higher up in your colon, that blood has a long, slow journey before it ever sees the light of day. It travels through your digestive tract over hours or even days. It gets processed by your body. By the time it finally comes out, it does not look bright red anymore. It looks dark. It can look like a deep, rusty maroon, or it can be completely black. Sometimes it even looks like sticky, dark tar. Most seniors miss this entirely until it is too late, simply because they are not looking for black tar. They think they are supposed to be looking for red blood. If you ever see a dark, sticky substance like that, you do not wait. You do not monitor it. You call your doctor that exact same morning, because that is a clear signal that old blood is coming from deep inside. But what if the blood you see actually is bright red? Can you just relax and assume you are safe? This is where real damage begins if you make the wrong assumption. If a cancerous growth happens to be located very low in the rectum, right near the exit, it is going to bleed bright red, fresh-looking blood too. It mimics a simple swollen vein so perfectly that it is terrifying. So color is a powerful clue, but it cannot be your only shield. You must also look at where the blood is located. A hemorrhoid leaves blood on the surface. But if the blood is physically mixed inside the stool, if it is woven into the center of it, that means the bleeding happened higher up while your body was still forming things. But here is what most folks just do not realize when they are quietly trying to figure this out in their own bathroom. Color and placement are just clues. They are not a final answer. And there is an even bigger myth about how these conditions feel that tricks thousands of people every year. I want to stop right here and address the most dangerous lie you have ever been told about your body. It is a belief that is so deeply ingrained in us that we do not even question it. We are taught from the time we are children that if something is truly, seriously wrong with us, it is going to hurt. We naturally associate danger with physical pain. And this is exactly why so many folks brush off the early warning signs of something severe. Think about a standard hemorrhoid for a moment. Because of where it sits, right at the delicate exit of your body where there are thousands of sensitive nerve endings, a swollen vein usually lets you know it is there. It stings, it burns, it aches when you sit down in your favorite chair for too long. It is incredibly annoying and hard to ignore. But here is what most people do not realize, and it is a truth that completely changes how you need to view your health. The inside lining of your colon has almost no nerve endings for pain. A tumor can silently grow to the size of a walnut or even larger, deep inside your digestive tract, and you will not feel a single pinch. You will not feel a cramp. You will not feel an ache. This goes against what you have probably always assumed, but a lack of pain is actually the exact reason this disease is so incredibly stealthy. When folks see a strange symptom in the bathroom but do not feel any discomfort, they naturally celebrate. They think, well, it does not hurt, so it cannot possibly be anything serious. I will just give it a few weeks and wait it out. I need you to hear me clearly. An absence of pain does not mean an absence of danger. In fact, if you see a warning sign like the ones we just talked about, and you feel absolutely fine physically, that is not a green light to ignore it. That is your cue to act. Because while you are waiting for it to finally hurt, that silent growth is busy changing something else entirely. It is busy changing the actual physical landscape of your digestive system. Think of your colon a bit like a standard garden hose you might use out in the yard. If you accidentally step on the very tip of the nozzle, the water still comes out. It just might spray a little differently for a brief moment. That is essentially what a swollen vein does. It sits right at the exit and might cause a tiny temporary disruption, but it absolutely does not change the core flow of how your body operates. But here is what most people do not realize about what happens further up the line. When a mass begins to grow quietly inside the walls of that hose, it starts to physically narrow the tunnel. The passage gets tighter and tighter with every passing month. Your body still has to get everything through, so it is forced to squeeze things past that growing blockage. Most seniors miss this until it is too late, simply brushing it off as just another weird quirk of getting older. But if you notice that things have suddenly become very narrow, almost like a thin ribbon or a pencil, and it stays that way consistently for a few weeks, that is a glaring red flag. A simple surface vein cannot do that. Only a physical internal roadblock can reshape things so drastically. But the shape is only half the story. The other thing that silent mass alters is your daily schedule. We all have our routines. Maybe you are an early riser, going like clockwork right after that very first cup of morning coffee. You know your body's rhythm better than anyone else. Remember what I said about Arthur assuming his drugstore cream was working just because his symptoms seemed to take a break? Here is why it matters. When you have a tumor creating an obstacle course inside you, your entire natural rhythm gets thrown into complete chaos. You might find yourself feeling sluggish and totally backed up for 3 or 4 days at a time. And then, completely out of nowhere, your body tries to clear the blockage all at once, resulting in sudden, unpredictable rushes to the bathroom. You start bouncing wildly back and forth between those two extremes, for no apparent reason at all. You have not changed your diet. You have not started a new medication. Everything else in your life is exactly the same. This is why acting early matters so much. Another undeniable shift is the constant feeling that you are just never quite finished. You stand up, wash your hands, but you still have that lingering heavy pressure down low. A strong sensation that you need to sit right back down. That is happening because the mass itself is taking up physical space, physically tricking your nerves into thinking there is still work to do. A temporary, harmless annoyance simply does not rewrite your daily routine like this. So if your schedule has suddenly become a guessing game, you need to listen. And the medical community is finally realizing just how often these specific signs are being overlooked. You might be wondering just how common it is for people to confuse these two conditions. The truth is, it happens far more often than anyone wants to admit, and the medical community has the data to prove it. I want to share something with you that really puts this into perspective. A recent review of clinical data, similar to findings often discussed in major journals like JAMA and by experts at the Mayo Clinic, found a startling trend. They looked at patients who experienced a significant delay in getting a proper colorectal cancer diagnosis. Do you want to know what one of the most common reasons was for that delay? It was the assumption, both by the patients and sometimes even during early clinic visits, that the bleeding and discomfort were simply being caused by everyday hemorrhoids. The research showed that because these benign, harmless swollen veins are so incredibly common in seniors, they essentially act as a mask. They hide the real problem. People often wait months, sometimes even a year, to get properly evaluated because they are treating a surface issue while the real danger continues to grow silently in the background. In fact, studies have shown that patients who experience rectal bleeding sometimes wait longer to seek help than patients who don't, simply because they convince themselves it is just a harmless flare-up they can manage at home. The researchers made it very clear. Having a history of hemorrhoids does not protect you from developing something more serious. In fact, it puts you at a higher risk of ignoring the early warning signs. This isn't meant to scare you. It is meant to show you exactly why you can never just guess when it comes to your digestive health. Which brings us to the most important part of our conversation today. What exactly should you do if you notice something isn't right? If you've recognized any of the signs we've talked about today, the dark colors, the narrow shapes, the sudden chaos in your daily schedule, I want you to take a deep breath. I know how easy it is to let fear take over. But here is what most people do not realize. Recognizing these signs is actually your absolute greatest advantage. It puts the control right back into your hands. The very first step is to pick up the phone and make an appointment with your primary care doctor. And I want to pause and address the elephant in the room right now, because I know exactly what stops folks from making that call. It is pride. It is a sense of dignity. It is the simple fact that hardworking, independent people do not want to sit in a bright clinical room and talk to a stranger about their bathroom habits. But this goes against what you have been told about being strong. True strength, the kind that keeps you around for your family and your grandkids, is advocating for your own life. Your doctor has heard it all. To us, this is just mechanics. We look at this exactly the same way we look at a blood pressure reading or a cholesterol check. It is just information that helps us keep you safe. When you call the clinic, you do not need to use any complicated medical terms. You do not need to diagnose yourself over the phone. Just use this exact phrase. I have noticed a persistent change in my bathroom habits over the last few weeks, and I would like to schedule a visit to rule out anything serious. That is it. That one simple sentence gets the ball rolling. When you see your doctor, they have some incredible, simple tools to figure out exactly what is going on. They might suggest an at-home stool test. You might have heard of it. It is often called a fit test. It is completely private. You do it in the comfort of your own bathroom, and it looks for microscopic traces of blood that the human eye cannot even see. Or they might recommend the absolute gold standard, a colonoscopy. I know that word makes a lot of folks cringe. But remember what I said about catching things early. Here is why it matters so much. A colonoscopy is not just a test to find cancer. It is an active prevention tool. If the doctor goes in and sees a small, harmless little bump called a polyp, they do not just leave it there. They remove it right on the spot. They snip it out before it ever has the chance to turn into something dangerous years down the road. You literally wake up from a short nap with your cancer risk completely erased. That is the true power of paying attention to what your body is trying to tell you. You are not looking for bad news. You are looking for the absolute best opportunity to protect your future. Knowing your own body, recognizing those subtle shifts in color, shape, and your daily schedule is the most profound way you can take control of your health. It gives you the power to act before a minor whisper turns into a major crisis. You deserve to enjoy your independence, to spend long afternoons with your family, and to live with complete peace of mind, knowing you are doing everything in your power to stay vibrant and strong. If you found this information valuable today, please do me a favor and share this video with a friend, a spouse, or anyone you care about. We all need a gentle reminder to put our health first. And if you want to keep learning how to protect your longevity, hit that subscribe button right now to stay updated with Dr. Carter. I am here to help you navigate it all. Thank you for spending your time with me today, and I will see you next time.